Imagine you're living with HIV and you're relying on a governmental program for your HIV medications to keep you alive, to keep you healthy. Now imagine that those medications are taken away because the money runs out. Or imagine that you're on a waiting list and you can't get the medications to begin with. That is the problem with the current crisis in ADAP, the AIDS Drug Assistance Program. I'm here at a conference for the ADAP Advocacy Association to talk about what's going on all over the country with waiting lists springing up. So what we're going to do in this blog is we're going to learn how to be a good advocate, what's going on with the ADAP crisis, and what you can learn to be a good advocate. And you're going to learn all of this right now.
We all have the same condition. It's called life. I'm living mine as a gay man and an addict in recovery who's dealing with aging and being a friend and finding happiness and staying healthy and having fun and enjoying laughter, all while living with HIV for more than 25 years. I'm Mark S. King, and this is my fabulous disease.
The best place to start is at the beginning. What is the ADAP program and why is it in crisis right now?
Well, the ADAP program stands for the AIDS Drug Assistance Program, and it is a federal state program that is designed to help people who are living with HIV/AIDS who are either uninsured or underinsured who cannot afford their life-saving medications.
And it is funded by who? Who's paying for this?
It is a joint program between the federal government and the state government, and then the pharmaceutical companies provide what are called rebates to the program that also fund the program. So you have people who we know that if you provide these medications to them, it keeps them healthy, keeps them productive members of their community. We also know that it reduces the risk of transmission of the disease to somebody who's HIV negative. Yet we're telling our people in this country, know your status, go get tested. From a medical perspective, we're telling people, go get treated. It'll make you healthier. And then we're telling, by the way, go get in line, we can't pay for it.
So that's why we're here. We're trying to help people access or maintain access to life-saving medications that are now serving 150,000 people around the country. Right now, there are about 6,000 people on waiting lists in various states, and over 3,000 of them are on the state of Florida's list. This figure also doesn't include an invisible waiting list. These are people who don't even try getting on the ADAP list because they figure they'll never get served at all.
People are scared now. They're going, I don't have a safety net. Like, if, God forbid, I become positive and I need to get medication, there's nothing there for me. So people are really afraid, and it's kind of galvanized people to say, this is an issue we need to pay attention to. This is about life-saving medication.
And there seem to be some strategies emerging. First of all, political action, lobbying our elected officials to put more money into the ADAP programs and wipe out the waiting list.
We've really become complacent that the government is going to take care of us, and it has never been shown that the government will take care of us for the simple sake of taking care of us. We as advocates and activists need to get out there, raise our voices, and to make the change that we know needs to happen.
You pick up the phone. That's step one. Step two is when that staff member answers the phone, you say, my name is Mark King, I live in your district. And step three is you tell them what you want. You tell them that the AIDS Drug Assistance Program needs to be fully funded, that in 2011 it's no excuse for an American living with HIV to have to wait for the very medications we know are going to keep them healthy.
Ring, ring.
Hello, this is the office of Congressman so-and-so.
Hello, my name is Christine Campbell, and I'm interested in making sure that you're aware of HIV/AIDS issues, specifically around the ADAP waiting list in Florida.
Ring, ring, ring.
Hello, Congressman so-and-so's office.
Hi, Congressman. I'm Jesse Fry with the Florida HIV and AIDS Advocacy Network.
Oh, hello, how are you today?
I'm doing well, thank you very much.
Do you live in my constituency?
I do. I live in your district.
Oh, great. What can I do for you?
I would like to appeal to you to help work with your colleagues to seek solutions to the current ADAP crisis.
Right now, there are over 3,000 people on the HIV/AIDS waiting list, and we need to make sure that that list is eliminated.
So, for instance, I could call up my elected official and say, I want for you to keep ADAP funding in my state because it's cheaper to give people medications than it is to care for them if they get sick.
Absolutely.
In addition, there are issues around the country that the list is over 5,500.
What you need to know is ADAP saves lives, and ADAP keeps people from getting sick and costing the state a lot of money to take care of them.
That's great. Great way.
The second strategy is to make people living with HIV more aware of other alternative programs that provide medications or lower their costs, and then get them signed up. Representatives from several of the major pharmaceuticals attended this summit and described their patients' assistance programs. That led to some interesting conversations.
This is $1.2 billion in state and federal money, 100% of which goes to the pharmaceutical industry. And let's look at it, okay. The regimen that we buy for $12,000, okay, sells in Africa for $64. So the gross margin is humongous, okay?
So you're assuming that that $64, it was what it cost the pharmaceutical to make that medication?
Less, because it had to be shipped and there's a middleman.
Right.
So yes, I assume that it costs them, $20, $30, $40 to make it. The rest is their margin.
Without the pharmaceutical companies and their research and innovation, we wouldn't have these drugs to begin with. So I don't think it's appropriate to blame the pharmaceutical companies. Are they charging too much? I think we can all agree yes. However, the pharmaceutical companies are stepping up to the plate and are expanding what are called patient assistance programs.
The pharmaceutical industry puts profits over people. That's it.
Holy Kalitra. That remark irritated this lady, a pharmaceutical rep that got so hot under the collar she left the room, which led to this.
What you should have asked her is, bottom line, how much profits last quarter did Bristol-Myers Squibb make? And it was still more than everybody in here combined, I'd be willing to bet.
I hope that this walkout is, a historic tipping point.
Well, it turns out the pharmaceutical lady didn't walk out. She just ran some laps around the building or something and came back. I really wanted to talk to her about her reaction to all of this, but she said her public relations people wouldn't let her speak to me. That pissed me off. So I'm going to forever refer to her as the mystery pharmaceutical lady and just show you this photograph of her from an unflattering angle.
Activism isn't about making friends. It's about pushing people to change. People don't change unless they're uncomfortable. So yes, people have to take a look at themselves where they can act differently and be differently to actually support the movement. And that may mean the pharmaceuticals looking at what they're doing and seeing what they can do differently to actually work to end the epidemic.
What can I say? We're advocates. We're passionate. Sometimes during the summit, people needed to just get off topic for a second and vent and share our common frustrations.
The dark side of HIV needs to be reminded, and we can't glorify that, you can just take a pill a day and go on and be a celebrity and be on TV and just have this fabulous life, because that's not HIV.
For decades and decades, but if we don't get people my age group involved, they're going to be like, well, this isn't such a serious matter, when in fact, most cases of new HIV infections are people of my age and younger. And they need to.
What I did was I had to go and seek my own information. I had to empower myself, and I believe to this day that's the reason why I'm alive.
And then I'm understanding, you need to meet, to plan, to do something, but sometimes you just need to do the damn thing.
Having all these different kinds of groups of people from different parts of the HIV community really work to show them that we have more in common than we do in differences.
So here's your final checklist of things to do to advocate. Call your elected officials and ask that ADAP funding be provided to eliminate the waiting list. You can find out who your elected officials are by going to www.votesmart.org and stick in your zip code, and they'll tell you who your elected officials are. To find out if your state has an ADAP waiting list or how many people are on it, or to get information about patient assistance programs, go to the AIDS Advocacy Association website. They've got all the information. I'm just calling to express my support for the AIDS Drug Assistance Program, ADAP, A-D-A-P, AIDS Drug Assistance Program. Senator Rubio may or may not be aware that there's a huge waiting list in Florida right now of people, Florida resident and a voter, and I just have a message for Governor Rick Scott. Just let Mr. Nelson know, please, that I appreciate him supporting to do everything he can to make sure that that waiting list is eliminated.
Okay, I got that here, and I will in this AIDS Drug
Assistance Program.
Sir. Well, I will pass your message on to the Congresswoman. We do appreciate your phone call.
Thank you very much.
You're welcome. Have a good one.
You too. I kind of made it my own. So anyway, that's how it's done. So please, as always, please be well and get on the phone.